Video will discuss claw hand due to ulnar nerve injury. So what's a claw hand? Claw hand is a flexion deformity at the interphalangeal joint because of the inability to extend the fingers and hyperextension at the metacarpophalangeal joint. Claw hand due to ulnar nerve involvement is an incomplete claw hand. So what's an incomplete claw hand? Hyperextension of the metacarpophalangeal joint and flexed interphalangeal joint of the ring and the little fingers. Ulnar nerve innervates the medial two lumbricals, the third and fourth lumbricals that supply the ring and the little fingers. So these numbers are confusing. Medial two lumbricals are the third and fourth lumbricals, and they supply the fourth and fifth fingers, which are little and the ring fingers. So what's the function of lumbrical? They extend the interphalangeal joint and flex the metacarpophalangeal joint. When lumbricals are gone, interphalangeal joints are flexed and the metacarpophalangeal joints are extended. Ulnar nerve injury or ulnar nerve lesion at wrist is the distal ulnar nerve injury, and the one at or around elbow is proximal ulnar nerve injury. So let's discuss the ulnar nerve lesions at the wrist joint. The ulnar nerve lesion at wrist joint causes unopposed flexion of the interphalangeal joints on the fourth and fifth digit. That leads to claw hand, and that's incomplete claw hand. And there is unopposed action of the finger extensors at the metacarpophalangeal joint that causes extension of the metacarpophalangeal joint. Also, patient is unable to abduct and adduct the fingers because it supplies adductors and abductors of the fingers, and there is wasting of the hypothinner muscles. The thinner muscles are towards the thumb sides, and there is flattening of the normal arches of the hand. So what muscles are not paralyzed? Three thinner and first two lumbricals, because these first two lumbricals are supplied by the median nerve, index and the middle finger. So what are the sensory defect in ulnar nerve palsy or a claw hand? Ulnar nerve supply the medial 1.5 fingers on both front and back side, and also palmar and the dorsal surface of the hand. So what are the defects in thumb in ulnar nerve palsy? Ulnar nerve supply the small muscles of the hands, adductor and the flexors and the adductor pollicis. So loss of adduction of the hand and the thumb due to the adductor pollicis paralysis. Let's discuss the proximal ulnar nerve lesions. The lesion above the origin of the nerves to flexor carpi ulnaris and flexor digitorum profundus. So what's the function of flexor carpi ulnaris? Flexor carpi ulnaris causes flexion and adduction of the wrist. So a paralysis of this muscle will cause weakness of the wrist flexion, and paralysis of the flexor digitorum profundus will cause loss of flexion of terminal phalanges of the fourth and fifth digit. And what's ulnar paradox? Ulnar paradox is a decreased claw appearance. And why does it occur? It occurs in a proximal ulnar nerve lesions because flexor digitorum profundus is paralyzed. That causes loss of flexion of the terminal phalanges of fourth and fifth digits. So flexion of the interphalangeal joint is weakened, which reduces the claw-like appearance of the hand. Remember, lumbricals extend the interphalangeal joints and flex the metacarpophalangeal joint. So what's the difference between the distal and proximal ulnar nerve lesion? In distal ulnar nerve lesion, there are no lumbricals. There are claw-like fingers. They cannot extend the fingers. Whereas in proximal ulnar region, there are no flexors. Flexor carpi ulnaris and flexor digitorum profundus gone. Patient can't flex the fourth and fifth fingers, but they are intact extensors of the radial nerve. So these patients, they can't make a fist.